Hello, I'm Hannah, one of the doctors. Sorry, I'll just wash my hands. What's your name?
I'm Laura.
Laura. I understand you've come to see me with some tiredness and fatigue, is that right?
Yeah, so I've been feeling tired for the last few months, falling asleep on the couch at night, thinking that it was just working too hard, but it's really getting to me now. So I was diagnosed with hypothyroid, started on some treatment, and I thought that that would sort of help, but it hasn't. I've had a rash on my skin. I've got some photos if you want to see those.
Oh yeah, certainly. Any photos would be great.
Yeah.
Oh gosh, yeah, that is quite extensive, and I'll certainly have a look at the end, yeah.
So the rash is gone now after some treatment, and I've also been getting some abdominal pain at night and bloating.
Okay, gosh, these symptoms sound horrible. So how long has the fatigue been going on for?
I'd say probably about 3 months.
Fine. And did that start around the same time as the tummy pain and the rash?
I've had tummy pain for quite a while, and I've always been bloated after eating and things, and I just sort of thought it was normal, but it's getting worse.
Fine. Tell me a little bit more about the tummy pain. Whereabouts is it exactly?
So it's on the right side, and it wakes me up at night. It makes me feel sick, so I wake up at night feeling nauseous, like I'm going to vomit. I had an ultrasound scan because I thought I had gallstones, but that was normal. Fine. But yeah, it's mostly right-sided.
And how would you describe that pain?
It comes and goes. It's sort of sharp, stabbing sometimes, and then but it's just sort of always underlying there. And
does it move anywhere, or does it just stay there?
No, it doesn't really move anywhere. I think it's mostly there on the right side. Sometimes it doesn't bother me. Sometimes it's a bit like a toothache of the stomach. But
and anything that you can think of that would make that tummy pain worse?
I think it's worse after eating.
Fine. So any particular foods?
Like carbs, I would say, like if I'm eating pasta or
fine,
heavy meals.
And so would not eating carbs and sort of things make the tummy pain better or not?
Yeah, I think I don't get the bloating if I'm not eating something that I would feel like was like a heavy meal, like pasta or bread or something like that.
Okay. And you said you feel sick. Have you ever vomited with this pain?
No, I just feel sick, which is what wakes me up in the night.
Yeah. How are the bowels?
I've always had trouble with my bowels going to the toilet. So
constipation wise?
Yeah.
So no loose stools at all?
No.
And when you do go to the toilet, do you notice any blood?
No, I don't think so.
And sounds like a funny question. What colour are the bowel movements? Are they, what would you say, normal, or are they pale?
Normal, nothing that I feel concerned about.
And do you ever have to wake up at night to go to the toilet?
Yeah, sometimes.
Do you? And when you do go, do you feel like you're completely void, or does it feel like there's more to come?
I could still go more.
Okay. Waterworks all right?
Yeah.
And how's your appetite?
I'm always hungry.
Are you? Okay. Fine. Any weight loss at all?
No.
Fine. Do you have any idea what you think could be going on?
No, I thought that the treatment for the thyroid would sort it out.
Sure,
Obviously, I thought I had gallstones, but that's been ruled out with a scan. So, no idea.
Anything that you're particularly worried about or that I can help you with today?
No, I'm just really, really tired all the time, and it's sort of getting me down. It's affecting my work. I haven't had any time off work, but I'm tired in the morning, I'm tired at night, I'm falling asleep, can't wake myself up.
Yeah, absolutely.
And it's just really, I just want to know what it is, really.
Absolutely. Just a few quick fire questions now, because you've told me that you've been feeling fatigued and that you've had this tummy pain with a little bit of bloating, mainly after food, and feeling sick, and bowels more constipated, and then the rash is all completely gone now.
It's gone, yeah.
Any breathlessness or chest pain?
No.
Any palpitations at all?
I do get palpitations sometimes, more so in the morning, but no.
Nothing like that. No headaches, no visual changes at all?
So I suffer from migraines anyway,
Oh dear.
so
Okay.
I'm on treatment for migraines.
Fine. Apart from everything that's going on at the moment, do you have any other medical conditions? You mentioned your...
Yeah, hypothyroid
yeah.
and pernicious anemia, so I'm on B12
gosh.
injections for those.
When were you diagnosed with that?
About 6 years ago.
Fine. And you get your regular injections for
Yeah,
that and
every
regular
3 months.
monitoring of the bloods? Fine. So hypothyroid and pernicious anemia, anything else that you receive medication for?
So I have postural tachycardia as well.
Okay,
So
gosh.
I take propranolol.
Fine,
I take
fine.
the propranolol for the migraines and that.
So medication-wise, propranolol, and you're on...
Levothyroxine.
Yeah.
And just the B12 injections.
Any allergies at all?
Just penicillin.
Fine. What happens with penicillin?
I get a rash.
Okay, fine. Family-wise, because you've got a few conditions that are sort of autoimmune related, any family history of anything?
So my grandma was diabetic.
Was she?
And I know there's a couple of family members that have got pernicious anemia and a hypothyroid as well on my mum's side.
Fine.
But I'm not sure about my mum because she sort of doesn't go to the doctors, so she doesn't know.
Okay, fine.
But yeah, on her side, some family history of autoimmune things.
Okay. And with everything that's going on, you mentioned work. So what is it you do for a job?
I'm a nurse.
Oh gosh, busy.
Yeah.
Okay, fine. Long shifts. How is it affecting things at work?
I'm just tired. So it's not affecting my work as such. It's just, getting up early in the morning and obviously long days, and I'm just falling asleep at night, and I feel like that's all I do.
Yeah,
go
exhausted.
to work, go home, fall asleep. Yeah.
Okay. It's a vicious cycle. Okay. Yeah. Do you smoke at all?
No.
Have you ever smoked?
No.
Fine. And do you drink alcohol at all?
No.
Have you ever drank alcohol?
Occasionally, but it's something that I've sort of stopped recently. So when I was younger, I did, but not anymore. And
we ask all of our patients, any other medications, illicit drugs, things like that?
No.
Okay, so you've given me lots to talk about. Anything that I've missed from the consultation, or anything that you think is relevant just before I examine you?
I don't think so, no.
Okay.
We talked about the bloating. It's quite severe when it happens, so I feel like it's like I always say to my partner, I look pregnant at night.
And how long? And that's after eating?
Yeah, and that's been going on for a while, as long as I can remember. Really, it's always something I say. So I couldn't pinpoint how many years or anything. It's just sort of feel like it's normal for me, but the pain's getting worse.
Okay, well, we can certainly make a plan at the end. Is it all right if I examine you now, Laura?
Yeah.
Lovely. Do you want to just make your way over to the examination table? Laura, I'm just going to wash my hands. Are you comfortable there?
Yeah.
I'm just going to start with having a really good look at you, okay? I'll just stand at the end of the bed for that. Am I all right just to lift your leggings up and just have a look? Because you mentioned this rash, where was it?
So it was on my arms, the rash.
Fine. Laura, if you're in any pain at all, just let me know. I'm just going to have a little squeeze.
Yeah.
You've got some tattoos here. How long have you had them for?
A few years.
Did you get them done? Where did you get them done? Was it in the UK?
Yeah, in the UK, yeah.
Could you just put your hands and just arms out for me? That's great. I'm just going to have a really good look. She said the rash is completely gone now, hasn't it?
Yeah, you can just see some scarring from it.
Fine. And just turn them over for me. I'm just going to have a little look at your palms now. And just turn the hands back over. Just going to feel your pulse while I have a good look at your nails. Have you noticed any nail changes at all?
No.
Silly thing now. Could you just pop your fingers together for me like this? Fantastic. Just pop them down. And I just need to have a look at your face and things and just in your mouth. Are you all right just to pull one of your eyelids down for me? Fantastic. Have you noticed any discoloration or yellowing of the eyes?
No.
Okay, great. And just open your mouth wide. Okay, great. And could you just pop your tongue to the roof of your mouth? Do you notice any ulcers in the mouth?
I do get mouth ulcers, quite
often.
As long as I can remember. I think more so before I started on B12 injections.
Of course, yeah. Any ulcers anywhere else that you noticed? Fine. And just lay your head back and just look over there for me. That's lovely. And is it all right if I just pull this down and just have a look at the chest? That's absolutely fine. Laura, at this place, I'm just going to lower the bed, all right, and I'll have a really good feel of your tummy, all right?
Yeah.
Just pop yourself down for me. Just going to have a look and feel of the tummy now. If you just, are you able just to roll your shirt up? That's fabulous. And perfect. And if you just pop your hands by your side, I'm just going to have a really good look at your tummy now, okay? I'm just going to have a gentle feel, but please tell me if it's painful, okay? And I'm so sorry, my hands are cold. Is that okay? Lovely. I've got to have a little bit of a deeper feel now, okay? Any pain there? No, good. Okay, good. I'm just going to have a feel for the kidneys now. It can feel a little unusual, but it shouldn't feel painful, okay? Good. Is that okay? No pain? Good. I'm just going to have a feel for your other organs now, okay? So it's slightly deeper pressure. Okay, so take a deep breath in for me and out. Good. And again, in and out. And one more time for me, in and out. I'm just going to do that just in the opposite direction, okay? So take a deep breath in and out. And again, in and out. Very good. And again, in and out. Are you able just to roll slightly towards me while I just have another feel, okay? You're comfortable there? Good. Just take a deep breath in for me, Laura. And out. Good. And in. And out. And one more time. In. And out. That's great. Just pop yourself back on the bed for me. I'm just going to have a bit of a tap now. Okay? It can feel a bit unusual as well. And are you able to roll towards me again? That's great. That's perfect. Just lay yourself back. I'm just going to have a final listen. That's great. Thank you very much. You can pop your top down. Okay, just sit yourself back. So, Laura, I think with what you've told me with the tummy pain, the bloating, especially after food, and I think we need to do some further investigation. One thing that I am a little bit concerned about is that you could have a condition with your autoimmune history that could lead you to have an intolerance to gluten. It's called celiac disease. Have you ever heard of that?
Yeah, I think so, yeah.
Okay, good. But then just with the other symptoms, I think it'd be sensible if we rule out any inflammation in the bowel as well. So at the end of clinic, what I'd like you to do, we'll get some blood tests and we'll just have a look for things like celiac blood markers, and we'll also check your thyroid as well, because that can also lead to the feeling of fatigue that you were having. We'll give you a little sample to get a stool sample, but I also think it'd be really sensible if we do some camera tests, just one down into the tummy to have a look and maybe take some biopsies, and something called a colonoscopy as well, which just has a look at the bowel. Is that all right?
Yeah, that's
Do you
fine.
have any questions before we end the consultation?
No, I don't think so. I think you've explained really well. Thank you.
Lovely, thank you.
Can you summarise this case for me?
Yeah, so this patient complained of a history of fatigue, abdominal pain, bloating and nausea. Importantly, she noticed these symptoms when she ate a carbohydrate heavy meal. She had no other red flag symptoms in terms of a GI history. Her bowels were constipated. She had no change in colour of the bowel, so no steatorrhea, and importantly, no blood. She hadn't lost any weight, and her appetite was better than normal. Systemic review was normal after that. Importantly, she did have a history of hypothyroidism and had a family history, I believe, of autoimmune disorders. Her main concerns from the consultation was that actually these symptoms she had no answer for, and they were affecting her job as a nurse, especially the fatigue, which was causing her quite a lot of distress.
What's your differential diagnosis here?
I think my top differential diagnosis, given the symptoms and the history of hypothyroid, would be that of an autoimmune disorder, so celiac disease. However, I think my other differentials would be to rule out inflammatory bowel disease, although she didn't have any features of tenesmus, of blood or mucus in the stool. These symptoms could all be due to IBS. And while very low risk, she is a young woman, it's always very important to rule out malignancy in these patients as well.
When you say IBS?
Irritable bowel syndrome.
She mentioned previously that she'd had a rash, and she showed you some pictures. Do you think this is relevant to the actual diagnosis?
Yeah, I think rash in terms of any GI upset is really important. In terms of celiac disease, you have to think about things like dermatitis herpetiformis, although the rash that she showed me didn't look like this. In terms of inflammatory bowel disease, I know that sometimes patients can present with erythema nodosum, but again, this rash didn't look like that.
What is the cause of celiac disease?
So celiac disease is an autoimmune disorder. It is an intolerance to gluten. Autoantibodies within the gut attack the small bowel when patients ingest gluten, and it can cause atrophy of the villi of the small bowel, which leads to malabsorption, malnutrition, things like that.
Is celiac disease hereditary?
It's not familial, but I know that if you do have a family member with celiac disease, then the incidence increases within the family. And certainly I think I know that if you do have a first degree relative with celiac disease, then you should also have testing for celiacs.
And how do you manage celiac disease?
I think something like celiac disease needs to be managed in a multidisciplinary team approach. First and foremost, diet is paramount. The patient should adhere to a gluten-free diet for life. I think importantly, it's always good to talk about smoking cessation, cutting down on alcohol, and maintaining a really healthy lifestyle. It's really important as well to talk about vaccinations, because anyone with an autoimmune disorder is more at risk of different infections going forward. I think it's really important to involve things like dietitians and the specialist nurses, as well as a referral to gastroenterology, because if the celiac disease is not well controlled on a gluten-free diet, then there are other medical therapies that we can try, such as steroids in the first instance.
With a gluten-free diet, hopefully symptoms remain under control, but sometimes it's difficult to adhere to a gluten-free diet, and if patients are unable to, do you know of any long-term complications of celiac disease?
Yeah, I think if patients don't adhere to a gluten-free diet with celiac disease, they will be more at risk of malignancy, especially bowel cancers long-term. I also think because of the malabsorption of nutrients, that long-term they can be at risk of osteoporosis.
Thank you.
Thank you.
This was a relatively straightforward Station 5 case. The candidate elicited a good initial focused history and expanded the history of presenting complaint adequately, as this is the area that is going to give the most relevant information that will lead to the diagnosis. It is obvious here that given the GI symptoms, rash and the autoimmune history, that celiac disease is the most likely diagnosis. But as with all stations, it is important to consider the differentials. It is important with Station 5 and communication stations that the candidate avoids medical jargon and trying to explain to the patient any potential diagnoses in layperson's terms. This candidate explored well any patient concerns and in specific how her symptoms have impacted her life. The patient's skin rash has now gone, but you will see from the pictures it was relatively severe, and in fact on biopsy in real life was proven to be a skin condition called granuloma annulari, the favoured mechanism being an autoimmune cell-mediated reaction. It was treated in real life initially with a gluten-free diet, but as it persisted, she was given initially immunosuppression, but then dapsone was needed. Dapsone unfortunately had to be stopped due to hemolytic anemia. It now appears to be under good control with just her diet. Of course, the classical rash in celiac disease is dermatitis herpetiformis, which is said to occur in around a quarter of patients with celiac. It tends to be itchy and blisters, and classically affects the elbows, knees, buttocks, face and shoulders. Treatment, as already mentioned, is primarily with a gluten-free diet, but drug treatment may be needed in refractory cases. Support for patients with written information, access to specialist nurses and signposting to patient groups such as Coeliac UK is important to consider, again in both Station 5 and communication stations.